There's a very strong link between type 2 diabetes and obesity. Evidence suggests that bariatric and metabolic surgery changes the chemical signals between the stomach, intestine, liver, and the brain, changing the underlying mechanisms of diabetes. Recent clinical research from the Cleveland Clinic called STAMPEDE showed that gastric bypass and sleeve gastrectomy surgeries were more effective than intensive medical treatment alone in managing uncontrolled type 2 diabetes in overweight or obese patients. Findings indicated that in patients who had metabolic and bariatric surgery, 77% of diabetes was completely resolved, defined as no longer taking diabetes medications. 86% of diabetes medications were reduced or no longer used. In gastric bypass patients, diabetes medications were no longer needed in nearly 84% of patients and were substantially reduced or no longer needed in 93%. In addition, clinical evidence is building worldwide that supports the STAMPEDE findings. Mangroni, in the New England Journal of Medicine in April of 2012, the conclusion was that bariatric surgery results in better glucose control than did medical therapy. Buchwald, in the American Journal of Medicine, 2009, the conclusion was that type 2 diabetes was resolved or improved in 87% of the patients following bariatric surgery. Bolin, Obesity Surgery 2012. The conclusion was that there is a lower proportion and likelihood of having type 2 diabetes at 5 years post-bariatric surgery. Swedish obesity subjects, New England Journal of Medicine in 2012. The conclusion is that bariatric surgery appears to be markedly more efficient than the usual care in the prevention of type 2 diabetes in an obese person, and there is a 78% reduction in the risk of developing type 2 diabetes following bariatric surgery.
Clearly, I think that there are a number of people who have poorly controlled diabetes that are not reaching target therapy, and we know the consequences of poorly controlled diabetes sustained over years. We know that these folks are very likely going to develop these horrible complications of diabetes: macrovascular heart attack, stroke, kidney disease, maybe requiring dialysis, amputations, retinopathy, and so forth. So I think, in my mind, the poorly controlled patient should be the one that should be really targeted first, because we know that these procedures, while we don't always get them into remission, we can improve their A1C, blood pressure, lipids quite dramatically with surgery. And some of them can come off medication, some will still require meds. But I think the goal is get them in better control. Now, on the other hand, there is value in addressing the early patient. The patient is just diagnosed, because a lot of the studies suggest that those that have fairly mild disease is a high percentage, about a 75% chance we will put them in remission. And by that I mean A1C less than 6%, no drugs. And that can be sustained over quite a long time, and they're likely going to have much better quality of life and may never really reach the point of having to require medications or insulin to treat their diabetes. We have hundreds of observational studies showing quite a dramatic effect of surgery in terms of lowering blood sugar, improving blood pressure, lipids, and many other comorbidities. So I think the value of surgery now we have this very strong evidence that surgery can be an additional tool that the endocrinologist, the internist can use to get their patients in better control, because it is far superior in terms of lowering blood sugar and sustaining that.
Since surgery works by changing physiology, maybe it's not so surprising that some of these operations can change the physiology of diabetes above and beyond, or in addition to, or in parallel with the changes in energy balance and the changes in body weight. If we look, for example, at gastric banding, both basic studies in animals and clinical studies have revealed that the degree to which you improve the diabetes after a gastric band is proportional to the amount of weight loss that the band produces. You can see sort of the equivalence on this slide that compares the rate of improvement in diabetes with the amount of weight loss. But if you look at the other operations, it appears that the degree to which you improve the diabetes is out of proportion to the weight loss, suggesting that maybe there's something extra in those operations. And through a variety of studies, we've been able to demonstrate that.